Let's talk about vaccines. We know vaccines is the only way out. From the 1st of May, on paper, we've entered the phase 3 of vaccination, and regular viewers of the program will know how closely we've been tracking this. We seem to have regressed to some extent. We were at some point in early April vaccinating close to 40 lakh Indians a day. It has dropped to about 16 lakhs. So this is the case. More Indians are eligible to be vaccinated. The number of vaccines being supplied is the same, but yet less per day are being vaccinated. The first question is, why is this the case? Where is the choke now in not only the supply chain, but in the distribution process as well? We have also seen a situation where today, for example, the state of Maharashtra has suspended its 18-plus vaccination program because they're saying they have to focus on dose number 2. We've also seen Delhi having to stop its doses for 18-plus for Covaxin because they need to keep enough for the second dose. Chief Minister of Delhi, Arvind Kejriwal, has asked for more manufacturers to be allowed to produce the vaccines so that there are enough. We're going to talk this evening about how we can improve the efficiency of the vaccines we actually have before more come into play. What are the ways we can go about it, and why are we seeing this anomaly in supply and demand? To speak on this, I'm joined this evening by Dr. Ashutosh Raghuvanshi, CEO and MD of Fortis Healthcare, Anant Bhan, a global health and policy expert, and Dr. J.A. Jayalal, the National President of the Indian Medical Association. Welcome to all of you, and thank you for speaking with us today. Dr. Raghuvanshi, let me begin by getting a sense from you on what the vaccine supply is looking like. I had the opportunity of speaking with you on the 1st of May, if you recall, when the vaccine drive started for 18 plus, and you had shared that Fortis, one of the few private players who've got vaccines, had a very limited dose. Can you tell us what the current situation is, sir?
Yes, so that was the supply we got, and post that we haven't received any more supplies. However, we have some visibility from Serum Institute about availability after the 3rd week of this month. So currently the situation remains same. With the limited doses available, we cannot activate all the vaccination centers, which we could have done earlier. It's a slow pace, as you said. That
so,
there's no.
Can you give any? Can you give us any details, sir, of what kind of visibility do you have, and is it all from Serum or is it also from Bharat Biotech? Are there any conversations going on now with other makers, including Sputnik, etc.?
Yes, we are engaging in discussions with all the three you mentioned, and obviously at this stage I am not able to give exact details because we don't have clarity on that. That is still under discussion. But both from Bharat Biotech as well as from Serum Institute, we have assurance of supply coming after 3rd week of this month. Whereas as far as Sputnik is concerned, the first phase is going to be important vaccines, which would be probably at a higher rate. But that discussion is still underway, and we don't have absolute visibility as to when that supply would come.
Okay, so, you know, the maths finally does catch up. And Anant Bhan, I want you to come in here. We know very well, and we've been saying since April, that the supply and demand is completely mismatched. And now add to that another 60 crore people because you've added the 18 to 44 bracket. Do you see effectively the 18 to 44 bracket being pushed back and those vaccinations being pushed back because the priority is focused on completing the second dose for those who've already received the first jab?
Thanks, Tamanna, for having me. Yes, absolutely. It looks likely that most states will prefer to get the second jab for those above 45, rolled out before they start giving the vaccine to those between 18 and 44. And in a way, it makes sense. Those above 45, especially those with comorbidities, are certainly still at higher risk from the data that we know. And, by actually opening it up to both the categories right now, we have a situation where there is certainly over demand. There's a lot of people registered on Covaxin who probably, are just searching for slots which are not available. So rather than having a competition where those between 18 to 45 are competing with those above 45 who still need to get their second dose. We should probably get the above 45 age group completed as soon as possible and then focus on the younger age group. That having been said, we also need to accelerate our vaccine drive, right? Because the numbers have gone down significantly since April. We certainly have a supply constraint. The demand has increased, but we are not able to leverage that by providing enough vaccines. And on top of that, I think we have this confusion where rather than a unified procurement process, you have multiple players, both the central government, the state government, as well as the private sector trying to procure and with the same manufacturers. Perhaps there would have been more efficiency by having centralized procurement. You could have distribution and delivery through various channels, but having this multiple price points, multiple procurers, I think is adding to the confusion.
But you know what I can't understand is, and Anand, this is a follow-up for you, why have we gone down from vaccinating 40 lakh people a day to 16 lakh people a day? Yes, the number of people who require vaccinations are more. Yes, the supply has not been augmented, but at least that supply exists, which is about 60 to 70 million doses a month. Why have our vaccination rates dipped to this extent?
Yeah, that's a bit surprising. I mean, it's likely a function of a few things. One is that there was probably some stockpiling which was made available to the states, and that has now been eroded. Fresh stockpiles are probably limited in nature. And that is certainly a cause. And because, otherwise, if there was a steady supply, then at least what was planned in terms of second doses, etc., should have been wrapped up by now. So it's a bit of a mystery, but, most states are complaining that they don't have enough doses. So, and the central says that they've sent those doses out. So, I mean, again, these doses cannot be lying somewhere mysteriously. Either they have been used up or they are just not available.
Okay, Dr. Jayalal, you were one of the votaries of opening up vaccines for everyone above 18 plus, and I recall that you welcomed the move. Now, on hindsight, would you say that this was premature? We shouldn't have maybe opened up without having a supply chain in place, because today you have a situation where vaccines are being cornered by those who are tech savvy and know how to use the Covaxin app. Sometimes coders are getting a march over others. Those who don't have access to internet or a computer are being left behind. And plus, second doses are now under threat.
Yeah, definitely not. I mean, what is opening up for the 18 years is the most welcome move in even at this situation, because at the second wave, what we are seeing is the population which are affected is much below the age of 25 to 45. That a lot of people are getting affected. Having set that target, that it should have been the responsibility of both the government and all the bureaucrats to work hard to ensure both the supply chain and both the production is enhanced. We have already passed through almost 30 days has gone from the decision which we had taken to ensure that from first. And it was quite a long period for us to augment our supply. We had a lot of options in front of us. A lot of resources were there, and we could have also augment the production capacity in the inside also. But even otherwise, even if you see that in average, we could produce 8 crore per month. That means already 4 months, we would have produced by this time 32 crores. But what we have spent is only 17 crore. So there is something more is happening. And what the production capacity, if it is something 6 crores from the Serum Institute, another 2 crore from the biotech. And by this time, every month we should have had 8 crores. But we are not producing, we are not vaccinating them. Why there is sudden stoppage? It is absolutely because there were 6,000 private practitioners or the private centers were there for the vaccination. The people cannot move far away only to the public health sector to get the vaccination done. Unless it is opening at the private sector, which is nearby to their house, the people will not come forward and take the vaccination. Now, that if you see at many places, people are waiting from 5 o'clock in the morning in the long queue to get the vaccine. But unfortunately, the supply is not reaching them adequately. There is a skew distribution is that fault. The supply is not going there. And paradoxically, we have reduced the vaccine hesitancy. Now, people are interested. They are looking forward, but we are not producing. We have stopped all the private setup which we were giving the vaccine, and the supply chain we are not giving. That is the reason why, and I think it is a failure of our bureaucracy to plan ahead and produce that in plan accordingly. And I will never say it is in hindsight and it is a faulty decision or a premature decision.
No, but Dr. Jayalal, private hospitals are allowed to procure the vaccine now. There is technically nothing stopping them. The formula which has come forward is 50, 25, 25, in fact.
No, yes, you're true, but the Apollos or the Fortis can get the vaccine. They can directly have an interaction. Our hospital, our country has more than 1,000 and 4,000 100-bedded hospital, 50-bedded hospital. They cannot take up the responsibility, individually talk with the Serum Institute and get the vaccine. Only the corporate sectors, they could have had some access to the Serum Institute and they can get the vaccine. Majority of the private practitioners in the country, those who are 50-bedded or 100-bedded hospitals, or less than that, have never had an access to the Serum Institute to get the vaccination. They are still hoping for the states. Now they get the vaccine and they will supply the vaccine for that. And that is why there is a delay in the private sectors. Other than the few corporate hospitals, none of the private hospitals are able to get the vaccine, and they do not get the vaccine from May 1st. So that is almost the absolute dip in the number of people getting vaccination is happening.
Dr. Raghuvanshi, do you want to comment on why we are seeing this anomaly? Is this temporary distribution hiccups that we are seeing? Because remember, the new policy was announced on the 19th of April to come into effect from the 1st of May. So my understanding is that vaccine manufacturers are still in the stage of completing their previous orders before they move on to the new orders which state governments and the private sector and players like yourselves have put into place. Even so, the absolute numbers that are being manufactured per day remains the same. Where are those vaccines going, and why are they not translating into higher vaccination rates per day?
Tamanna, as Dr. Bhan and Dr. Jayalal said, seems to be a mystery. However, there are certain things which are facts. In the first phase, what was happening is that the government was procuring the vaccination and government was supplying to the private sector as well as to the states. So the distribution was very well defined. However, there has to be a consistent policy. When the policy was changed and the strategy was changed suddenly, the system was not put in place possibly. So theoretically, as you said, nothing stops us from procuring the vaccine, but where is it available? Even the larger chains, as Dr. Jayalal is saying, even in the larger chains are finding it extremely challenging, and I cannot even imagine how hard it is for a small hospital to procure vaccines in this state. We were struggling and we barely got 30,000 doses, which is sufficient for just maybe 1 or 2 weeks to disperse that much doses. So I think the problem lies in stating an intent to do something, which probably is required as well. And as Dr. Jayalal said, and I agree with him, that the strategy to vaccinate everybody is correct. But it should have been done with preparation, adequate preparation. If we had chosen the path of vaccinating people above 45 as our first step, then we should have either ensured that there is adequate supply, or we should have stuck to that policy till the time those people had received the second dose. So I think there has been a complete failure in planning, and that is what has led to this kind of situation. The supply is still not consistent and it is not predictable. And that's why we are not even able to plan. A lot of large corporates are willing to pay for the vaccines. They are approaching us. They want us to set up systems for them, but we are unable to help it because of the simple reason that we don't have any visibility on supply. If that part was visible, then we could have vaccinated a lot of large corporate employees and their families. And we have the ability to do that.
Yeah, a suggestion has been made today by the Delhi Chief Minister Arvind Kejriwal. Anant Bhan, this question is for you, that open up the manufacturing to vaccines. And this is something that, has been a point of discussion for the last few days, especially after the United States also got on board with temporarily suspending patents for COVID-19 vaccines. Now, in the Indian context, is this feasible? Is this doable? And is this the only way? Because even with the maximum amount of augmentation possible that Serum Institute of India or Bharat Biotech can put through in their current capacities, it seems like a drop in the ocean compared to the number of vaccines we need. I mean, there's some calculation that at the current rate, will take another 3 years to vaccinate everyone.
Yeah, we certainly need more sources of vaccines. It could be either the existing two manufacturers. You could have more vaccine companies coming into the fray who are already manufacturing vaccines. So obviously those discussions are happening. But we also can have strategic agreements with other manufacturers. In fact, I think Bharat Biotech already is doing that with Indian Immunologicals, if I remember correctly. And similarly, there was this talk around Hopkins Institute producing Covaxin as well. But, in some circumstances, this will take time because you cannot overnight start manufacturing vaccines. It has to go through due process, including quality checks, etc. And you might either already have a production line or you have to create one. So that will take some time. That having been said, one of the things I'm a bit surprised about is that there is actually some capacity in the public sector, which unfortunately over many years has been allowed to decay. So CRI Kasoli, the Hopkins Institute in Mumbai, a large vaccine production park in Chennai, in Chengalpattu, all of these are in the public sector, which were supposed to be vaccine manufacturing centers, but they are not in the fray. They have not been talked about. Perhaps there is a time to look at these facilities, see what needs to be done in terms of investment to get these up to speed to manufacturing capacity, quality again, and utilize those as well. We should be looking at all potential sites where vaccines can be manufactured and ensuring that they then add on to our available, supply for vaccinating our customers.
Dr. Jayalal, what is the way ahead? And at the current rate, when do you see this process actually moving forward? I want to understand from you also, what are the concerns and challenges if people don't get their second dose? Does this make their first dose beyond a certain point completely not helpful at all? And will they have to be vaccinated all over again?
What we are now knowing is the second dose vaccination is postponed. That is a 6 to 8 weeks duration is given. And some of the studies even say 8 to 12 weeks is ideal time, especially in the UK and all. They have followed the 12 weeks gap between the first dose and second dose. So there is enough time for us to take the second dose. It is preferable to have in the 6th week or as the 8 weeks. That means another 2 to 4 weeks are available for us to cope up with the second dose, which we needed at this time. There are two sectors where the country can take it. One is, as already you have mentioned, the IPR, intellectual property right, if it is opened up, and there are many companies who can come forward and produce the drug. And especially, like what Anant sir has said, in Chengalpattu, there is a unit which is built at the cost of 900 crores and has a capacity to produce 580 million doses of the vaccine. But it is not utilized. Unfortunately, when the Supreme Court, the government has said, nobody is coming forward to take the tender. That is not an excuse. And the government itself should take up the responsibility. It is coming under the same Bharat Biotech, the same technology, the same culture mechanism is there. So they can transfer the technology and start producing the drug immediately from that. And again, within another 15 days, then we will be able to get a large chunk of vaccine can be produced indigenously. And thirdly, they must also open up. The Sputnik was permitted, that some of the dose has now come in, but still we have not settled out how it is going to be distributed. And there are few other vaccines are also on the anvil. If there is a will, definitely there is a way. The government should come out openly and do that study and make it available. Since the government is persisting on the differential pricing system, at least that should follow up and open the market, free market, and the people who can get the vaccine or import the vaccine from other countries. The J&J vaccine is available, Pfizer vaccine is available. If that kind of, some kind of mechanism should be built in, and we should try indigenously, we should get from the more sources. Definitely there is a possibility. India has a rich tradition in vaccination. India has overcome the smallpox and polio. We were able to eradicate it just by vaccination. So we, with a rich tradition, which experience, I'm sure India can definitely go forward and see that the vaccination or the universal vaccination can be implemented in this country.
You know, we have to get on with it sooner than later. We can't keep wasting time over what is happening. There has to be some explanation why we have gone down to 16 lakh vaccinations a day when we're producing the same amount, and the pool of those who are supposed to get it has widened. It only points to a choke up in supply, in distribution, which needs to be fixed immediately. We cannot waste more time on this. I want to thank all of you for joining us on the first discussion and throwing light on the issues that we face right now.